Hi, I'm Dr. Brad Shook. I'm a chiropractic physician in Hickory, North Carolina, and today I want to talk to you about how chiropractic can help someone that has been in an auto accident where they're riding a motorcycle, they've been struck by a car, or been injured while riding their motorcycle. The important thing to understand about motorcycle injuries and motorcycle accidents when you're on a motorcycle is that you're more exposed to an injury because you don't have all the protection of a large car. Also, motorcycles don't weigh as much as vehicles that strike them, so more of the force of the impact is transmitted into the bike and ultimately creates more problems for you. So there are different types of problems that occur with motorcycles. Obviously, when you're in an accident with a motorcycle, it's very easily to be thrown from the bike, and there are lots of different and varying degrees of severity of types of injuries that can occur. Most commonly, I would say even at the more mild end, the less severe end, are going to be spinal, muscular, and ligament injuries. Now, these vary in severity. I mean, they can be minor, they can be very severe, but a lot of times in motorcycle accidents, if you're really hit or someone pulls out in front of you and you're thrown from the bike, there are a lot of other problems to worry about too. But one of the things that we do not want to neglect, if you don't have fractures, okay, thank goodness, right? But if you have spinal pain, you need to be worked up appropriately. And here's the thing. A lot of times when you're in an accident like that, there may be broken bones, there can be a lot of other concerns, and everything else, and soreness of the spine, where they take, typically though, the emergency room or doctors will take x-rays of the spine, and if they don't see anything obvious, they say, okay, spine's fine, let's deal with this broken bone or arm or whatever else is occurring, right? That is more of an emergency. It takes a priority over the other things that are not apparently as bad. Okay, that's appropriate. However, you do not want to ignore the fact that the spine took a significant trauma. And one of the most neglected things that I see, and I've treated thousands of cases, and I have never once seen, I'm in Western North Carolina, I've never once seen someone come to my office for help that has been in a motorcycle accident that has had the right type of x-rays taken and the appropriate workup, in my opinion, that's thorough enough to assess the ligaments of the spine and whether they were severely damaged or not. See, most people, when they have their spine x-rayed, they either lay them down or they just have them stand up. And if you're laying down, you don't see how the spine is functioning under a load. That's the first mistake. Unless you have to, a lot of times after a trauma like that, they lay you down for a reason. And the reason is because if there's any fractures, they don't want you to put weight on it where it could create more harm or damage. So they have you typically braced, and they lay you down and they take a picture, and if they're hoping not to find that you don't have fractures, and they don't usually take more x-rays after that. So when you're not weight bearing and you might be strapped in, they're just screening for fractures. Okay, the problem is they're not looking at the spine, at how it's functioning now. Have the supporting structures, the 10 ligaments that wrap every, two bones of the spine together, between every two bones of the spine and disc. We call that the spinal motor unit. All you need to know is that when you have, this is a model of two vertebrae and the disc, there are 10 ligaments, which are not on this model, but they wrap the spine, and they run the entire length of the spine. Those ligaments, if they're damaged, you don't see how the spine's functioning. It will carry the load differently. You'll see shifting in those bones. You'll see that if you have the person to bend, that they'll have excessive rotation or bending of the bones. And the thing is even if when you take these specialized x-rays, you look to see and try to determine the severity of ligament injuries, you have to measure it. So we use specialized computer software that is actually the same type of software that's used to conduct research on joint mechanics and movement. We use that same software, and that software is specifically designed for this purpose, to compare the amount of movement of your spine to published research and normals to tell us, is there ligament damage or not. This is the biggest problem and the biggest gap that I see in the workup of motorcycle injuries. So if you've been in an accident like this, listen, if you have fractures and other things that are immediate concerns, get them taken care of. But listen, if your lower back or your neck is sore, you have whiplash, the pain may go away in a few weeks. It often does. But listen, if the ligaments are damaged, it will still be there. It is a permanent injury. It does not, the ligaments do not come back together. The main thing is you want to know if that's occurring, and then you want to make sure you're doing the right things so you don't heal back wrong. We all know someone that said, hey, whenever I was in the accident, I was never the same afterwards. We all know someone like that. And you can do a lot to minimize those risk factors if you get the proper workup and you start working on it to help those ligaments in the spine heal the best possible as early as possible, because you've only got a window of time while your body's putting down scar tissue. I tell people there's 3 different stages of healing that your body goes through, and the best time is the first 3 months after you've had an injury, because your body's creating scar tissue. I tell people it's kind of like a cement truck. That first 3 months is when it's pouring the concrete, right? You need to be smoothing out that concrete and not just let it pile up during that first 3 months. If you're smoothing it out by doing the right types of therapies and the right things to help improve the quality of scar tissue, you're on the right track. If you're not, it's going to be piling up. That concrete's piling up, and it's going to be, that's basically the scar tissue formation is getting thicker and it's weak. It's not as strong, and it creates a lot of problems. The new nerves that grow into it become tangled. They become more sensitive. So you need to be doing the right things as soon as possible. So get your priorities, get the things taken care of. If you've got something broken, if you've got other more pressing injuries, absolutely take care of those. But then get your spine worked up so that you can get a proper diagnosis for your spine, because the last thing you want is to have ligament damage that causes the bones of the spine to no longer have good integrity, to be loose. So when you're looking around and moving, you get a little bit of movement. Get a little bit of movement. Causes friction, breaks down the spine. That is not what you need. You need to be absolutely working to properly care for your spine if it's been injured. So take care of yourself. I hope this has been helpful in understanding how chiropractic care, which is what we do, our workup, and we have numerous therapies other than just spinal adjustments and manipulation. We have a lot of advanced therapeutics, laser therapy. We have non-surgical spinal decompression, which is fantastic. We've got active therapeutic movements too, computerized spinal adjustments that are gentle, and a lot of pain relief therapies. We've got a lot of different tools that you've probably never heard of that can be incredibly beneficial. So if you need anything, you have any questions, I'll be happy to take a look at your case and let you know if I think I can help you. But I hope this has been helpful and informative on how chiropractic care may help you to benefit recovery after a motorcycle accident. So I appreciate you. Hope you have a wonderful, wonderful day. Thank you.